Our final interview is with Dr. Jimmy Gutman. Dr. Gutman is a board-certified emergency physician who now practices family medicine. He was chief resident in emergency medicine at Emory University in Atlanta and undergraduate director and residency training director of emergency medicine at McGill University in Montreal. Dr. Gutman is an expert on the role of GSH, or glutathione, in health issues. He's the author of The Ultimate GSH Handbook, a cornerstone work on GSH and its functions, and author of a newly released book entitled Glutathione GSH, the Body's Master Agent. Here to speak with Dr. Gutman is John Molson.
In your previous book, you had chapters on Alzheimer's, Parkinson's, heart disease, diabetes, hepatitis, and other illnesses. What new topics are covered in the second edition?
Well, John, I'll just try to cover some of them briefly. I looked a lot more closely at environmental issues like mercury and lead toxicity. I discussed the role of glutathione in dentistry. I touch upon multiple chemical sensitivity and chronic fatigue syndrome. There's another whole chapter on gastrointestinal problems that include gastritis and stomach ulcers, stomach cancer. We're looking at the role of glutathione in Helicobacter pylori, pancreatitis, inflammatory bowel disease, ulcerative colitis, and Crohn's disease. This chapter on stomach problems and digestion problems is really a biggie. So often the question is also raised about protein intake in relation to kidney disease. And as some of you know, high proteins might be a problem for some of these individuals. I've written a chapter specifically on kidney failure and dialysis so that anybody reading this chapter will be very comfortable using Immunical properly. There's a lot more, John, including dermatology and ophthalmology, pregnancy, schizophrenia, and of course the role that glutathione plays in sports medicine and the healthy individual.
This sounds like an awfully long list for one substance to take care of, and I'm sure many health professionals will initially view this with some skepticism.
As they should. I think the most important thing a person can do for their health and for the health of their patients is to do their homework. When you understand glutathione in each and every single one of your cells, you start to begin to grasp the application in so many disease processes, especially those relating to oxidation and detoxification. When a doctor picks up my book, he or she is never interested in what Dr. Gutman has to say. They'll immediately flip to the back of the book and look at the references. It is, after all, much more important to see what the entire scientific community has to say rather than one person's opinion.
One exciting area is the field of pulmonary medicine. What different lung diseases do you think raising glutathione can potentially help?
Well, there's an extensive chapter on lung disease that I put together, and it doesn't only deal with common problems like asthma, bronchitis, emphysema, and cystic fibrosis, but it looks at other things that glutathione has in addressing, especially one biggie, cigarette smoking. And just recently, Dr. Larry Lanz of McGill University, he published really an excellent case study in the American Journal of Physiology on a patient who had a very dramatic improvement with pulmonary fibrosis. This is the kind of ongoing research and medical validation that keeps us excited.
Many people ask questions about physical injuries, wound healing, and burns. Can you see an application for raising GSH in the field of surgery?
Well, when you look at surgery is just essentially a controlled means of trauma. I mean, how else can you describe cutting somebody open and removing parts of their body? The act of surgery releases literally trillions of free radicals. I'm a strong proponent of loading up on Immunical both before surgery and as soon as possible after a surgical procedure. You know, we go back historically, and after all, some of Dr. Bunas's earliest work was looking at enteric feeding, which is a method to address the digestion of even the most challenged patients. Raising glutathione has been shown to not only speed up the healing process of both surgical wounds, but also accidental trauma, including the damage that we see from thermal burns. So I think in the next few years, you'll really see the medical community focusing a lot stronger on nutritional support of these types of patients.
And I'm sure that in your research you've come across many novel ways that raising glutathione may impact our health. One of the concerns of any product, be it a pharmaceutical or a natural substance, is its potential effect on pregnancy or the unborn child. This is an area you seem to have developed a pretty strong opinion on in regards to glutathione. And can you tell us your personal philosophy on GSH modulation in pregnancy?
When I do research on glutathione, I try to access the most recent articles, the most cutting-edge research that's being done. And it is just amazing that month after month I come across research that really we're beginning to understand how important glutathione is in an incredible spectrum of disease processes and an incredible spectrum of how it helps our body to prevent these diseases. One of the aspects of pregnancy is whenever a drug company or a natural food company or a supplement supplement company comes up with a product, there's always this fear about giving it to a pregnant woman or a lactating woman because very often you just can't tell what's going on. And the original company line from Immunical was that pregnant women really need to be cautious using our product. And I think that was more of a medical legal statement than a medical one. So I'm really just going to talk about my own personal experiences going through the literature. I have not found a single piece of literature that does not point towards the fact that glutathione, raising glutathione in the pregnant woman, is a good thing. When we look at the role of glutathione in pregnancy, it impacts many different processes. We're talking about things like hypertension in pregnancy, preeclampsia, gestational diabetes, and probably the most important area is toxicology. John, we've had talks before where we discussed the importance of glutathione in the liver. And the reason why glutathione is so important in the liver is because the liver, after all, is your major organ of detoxification. Now, when you look at the role of the placenta, now this placenta is the interchange between the unborn child and his or her external environment. This is where the little guy gets all of his nutrition and whatever he or she needs from mom. One of the highest concentrations of glutathione in any tissue can be found in the placenta. And the reason why that is because the placenta also serves as an organ of detoxification. This is the way this little kid is filtering out all the toxins that mom may be eating or drinking or breathing, and it protects this fetus, this developing child, from malformation, from many other defects that can be found because of toxic overload. So I really stress raising glutathione in pregnant women.
It may follow then that pregnant women have a greater demand for glutathione than the normal human being.
Absolutely. One of the most striking changes in physiology, one of the biggest changes that a human body can go through is during pregnancy. After all of a sudden, one person turns into two. The demands on that kind of a physiological change are very great, and glutathione levels will go down.
Jim, what about lactation or breastfeeding?
When we look at a product, for example, like Immunical in Canada is called HMS, and that stands for Humanized Milk Serum. When you look at human breast milk and you isolate the proteins that are in human breast milk and you compare it to HMS 90 or Immunical, you won't find another natural supplement that has a closer spectrum of the proteins that you find in mother's milk. So in fact, we refer to it as mother's milk for adults. So after all, if you're giving a child natural mother's milk and you're giving the mother something akin to mother's milk, there really is no problem in this as far as toxicology. In fact, again, it's obviously something that should be encouraged.
Lung doctors have been using drugs to raise glutathione towards the treatment of pulmonary diseases for years, especially NAC, in the treatment of cystic fibrosis. Do you see a place for the expansion of use of TSH-enhancing therapies in other conditions?
Well, certainly. We've been using N-acetylcysteine, or NAC, for many years to break up the thickness of secretions and mucus in cystic fibrosis. This is one of the mainstay of treatments for these young adults and kids. In Europe, if we follow the European medical example, they don't only use glutathione-raising drugs in cystic fibrosis. They use it in asthma, in chronic bronchitis, in acute bronchitis, in emphysema. A lot of the research that's been done recently, we're looking at raising glutathione towards the treatment of pulmonary fibrosis, of adult respiratory distress syndrome. I'm going to make a little prediction here that probably in the next 5 or 6 years, you are going to see this as a rather accepted traditional form of treatment for pulmonary disease, and that is raising glutathione. Now, after all, we can do it raising glutathione several ways. We can use drugs, but the problem with drugs like N-acetylcysteine is they carry a lot of side effects. You don't feel good taking them. Or you can take a natural product to raise glutathione, whereby the side effects are not noted, and instead of having to take a drug 3 or 4 or 5 times a day, you just take a natural product 1 time a day, and it's metabolized slowly, and you get the same positive effects.
You had initially voiced concern about the use of protein supplementation in patients with severe kidney disease or who are on kidney dialysis. What are your feelings now about it?
Well, you see, people with very severe kidney disease or very severe liver disease are told by their health practitioners that they have to take care and pay attention to the amount of protein that they're taking in, because some of these patients will not tolerate high loads of protein. protein. It will make them worse. And I get a lot of phone calls, Dr. Gutman, I've got a patient who's got kidney failure, and I'm afraid that they should not be taking the Immunical because, after all, Immunical is 90% protein, or a little bit more, in fact. And my response to them is, by all means, they should be taking Immunical. Why? Because when we look at proteins, when we look at protein chemistry, we assign to a protein something called a biological value. And in simple terms, what a biological value of a protein is how much of that protein is made up of essential amino acids versus non-essential amino acids. Obviously, the more essential amino acids you have, the more important this protein is for supplying your body with what it needs. You will not find another natural supplement out there, another protein supplement that has a higher biological value than Immunical. So if you're limited to the amount of protein that you're going to take the best protein you could find. And you're much better off having a package of Immunical than going out and having a hamburger.
Many people who have had stomach and intestinal problems have begun using Immunical. I've seen in some drafts of your upcoming material, you have written about links between glutathione and gastrointestinal disease. I know 20 years ago when Dr. Bruno started researching this product, his previous focus was on enteric feeding or tube feeding. Can you elaborate on this?
Well, you see, this is a product that is extremely easy to digest and provides basic nutrients that the intestine craves for and the intestine can handle very easily. Initially, it was intended to give this product to people who are suffering after trauma or after an operation, and certainly in trials with patients with HIV or AIDS. These are people that are very compromised when it comes to their digestion. So the idea was to come up with a protein that would be easy to tolerate and have a high nutritional value. And as you know, over the years we discovered all the other positive benefits that come along with it. And when you look at the research, there are links between glutathione and gastritis, links between glutathione and ulcer disease, links between glutathione and stomach cancer, pancreatitis, inflammatory bowel disease, ulcerative colitis, Crohn's disease, and the list goes on and on and on. See, a lot of these diseases are very much affected by the degree of something we call oxidative stress, especially when you look at something like the pancreas. What the pancreas does, it secretes certain enzymes, powerful chemicals that break down food. Some of these chemicals are powerful oxidants. The way the pancreas protects itself and the way our normal tissues protect itself from these powerful oxidants is by using its own natural antioxidant. And guess what? The natural antioxidant is glutathione. So high glutathione levels are very, very important in our body's ability to protect itself from its own digestive juices. So that's just one small little point about glutathione digestion. If we had an hour, we could probably start to scrape the surface here.